Hello everyone. So today I'm going to be talking to you about adhesive capsulitis, which is my medical term for Ms. Nawyer's PTA 250 class. So adhesive capsulitis is more commonly known as frozen shoulder, and it is a painful condition in which the movement of the shoulder becomes very limited. And this is due to the connective tissue becoming very thick, stiff, and inflamed. Common signs and symptoms of frozen shoulder can be broken down into 3 stages, and this is the freezing stage, the frozen stage, and the thawing stage. The freezing stage can last between 6 weeks to 9 months, and this is when the shoulder starts to become stiff and painful to move. Most patients report that most of their pain is felt at nighttime. The frozen stage lasts between 2 to 6 months, and this is when the pain can slightly decrease. However, the stiffness becomes more and it becomes harder to do daily activities. And the last is the thawing stage, and this can last between 6 months to 2 years. And this is when both the pain and the movement starts to increase. Full recovery is reached when there is no more pain and most, if not all, movement is back in the shoulder joint. On to the diagnosis. When you go to the doctor, first he will go over your symptoms, and then he will perform 2 tests on you. The first one being he will take your shoulder through passive range of motion. And this is where he will he will look and see how painful it is and how limited you are in the motion. Next, he will then make you go through active range of motion, where you do the movement. So again, he can see how painful it is and how limited you are in your movement, and then he will compare these 2. Next, he will probably go through, you will go through an x-ray to just have a visual of the joint and be able to fully see it. So treatment, most of the cases in frozen shoulder they are going to be referred to physical therapy, and this is to increase range of motion and help in daily activities. NSAIDs such as aspirin and ibuprofen can be taken in order to decrease the inflammation and help with the pain. Things such as cold compression and E-stim can also be given. This is usually given in physical therapy. So PT session, you will often begin with a hot pack, and this is just so it can loosen up the shoulder joint and help it to stretch so range of motion can be increased faster, and then it'll end in a cold compress to help with the pain and the inflammation. Oftentimes a cortisone injection will be given to decrease inflammation in the tissue surrounding the shoulder joint. If these do not work, then you can go through either 2 surgeries. One is manipulation under anesthesia, where they put you under anesthesia and then they stretch your shoulder joint to increase the range of motion. Or the next is shoulder arthroscopy, which means they make tiny holes in your joints to release the tension. So in physical therapy, a good exercise to do for frozen shoulder would be a non-weighted standing pendulum. This exercise would be useful to a patient in the freezing stage of adhesive capsulitis. The standing pendulum uses the weight and momentum of your own arm and body to encourage the shoulder joint movement. It is used to increase range of motion and to help promote the healing of the connective tissue surrounding the shoulder joint. It should not increase pain as long as it is done correctly. And it also is good for helping it in the beginning stage so that you can go on to more advanced exercises, such as using a weight or so on. So in order to do the standing pendulum, what you're going to do is you're going to brace your non-affected arm on a table and bend your hips to about 75 to 90 degrees. You will then position your feet past shoulder width apart and allow the affected arm to hang loosely. Then you will shift your body weight from side to side, just in a circle, to allow your arm to move in a circular motion. And you would do this for about a minute, or otherwise noted by the therapist. Thank you for listening, and I hope this gave you more on adhesive capsulitis.